One of the most common complaint I hear from most of my patients, doctor, I've used minoxidil or I've taken multiple sessions of PRP, and in some cases people have done a transplant also. Despite going through all these treatments, they still have hair loss. The important reason here is that whatever treatments that you're using are mainly only controlling the hair loss rather than treating the hair biology. Now, in this video, we're going to go through 5 important reasons why you still have hair loss despite using multiple treatments. The first reason is lack of maintenance treatment. Generally, in hair loss, of which the most common cause is pattern alopecia or baldness, what we call, we divide the treatment into 2 phases. The first phase is the active treatment phase, and the second phase is the maintenance phase. Generally, this active treatment phase lasts for about 6 to 8 months, and maintenance phase usually continues for a substantially long period of time. So, during the active phase, there is active good control of hair loss, and you will start seeing regrowth of the hair. So when you take the active treatment and stop with that active treatment without any maintenance treatment, the hair loss will eventually come back. The second reason is you have treated only the surface. Many a times, patients generally tend to follow a lot of home remedies, some kind of oils, shampoos, serums in order to control the hair loss. This might be useful for a short period of time, but generally the hair fall tends to rebound back once this effect of this surface treatments is gone. And then we come to the most important third aspect, that is getting a proper diagnosis. Hair loss is not just about only about the baldness or about some vitamin deficiencies or some kind of stress related. It's quite deep. There are many reasons by which you can have hair loss. Some of the common examples are alopecia areata, or you can also get some scarring alopecias wherein there is a permanent hair loss condition. So it is very important to get a proper diagnosis, do proper trichoscopic assessment of your scalp, and then, if necessary, some hormonal or nutritional investigations to come to a pinpoint diagnosis and then start the treatment. The fourth important reason is a new trigger has started. So, what are these triggers in your hair loss journey? A trigger might be a severe stress for like 4 to 5 days, not able to sleep properly, or you're affected by some kind of an illness in the form of a fever or a major weight loss or weight gain that happened. So the tricky part about the trigger is that they don't show immediately. So once the trigger happens, the hair goes into a resting stage. So this stage might last for 3 to 6 months. So identifying these triggers and controlling them and treating them is a very important aspect in your hair loss journey. Last but not the least, having unrealistic expectations and not knowing the actual biology of hair loss. So many a times I get inquiries from my patient that, doctor, I'm done with using any treatments whatsoever. Just do a transplant for me and then I'm done. So this actually is a very wrong concept, because transplant generally only redistributes your hair from a permanent to the temporary zone. But the hair that are already existing in the temporary zone have to be saved. And also your transplanted hair, if you're not taking proper treatment, can get thinner over a period of time. So this aspect has to be addressed. Understanding the hair biology and having a in-depth knowledge about all these things will prevent the hair loss from coming back.